Welcome back. The Alzheimer's Association is calling on the FDA to accelerate approval of the new drug to treat the brain disease. New data shows the experimental medication can slow the progression of the disease, but critics are questioning whether the benefits are worth the risk.
Alzheimer's patient John Teeling is feeling optimistic about an experimental treatment for the mind-destroying disease.
Anything's good, isn't it? Anything that can delay it or give me hope, yeah.
New research from the makers of the drug lecanemab shows it modestly slowed disease progression by about 5 months in early-stage patients.
It boils down really to one thing. That is more time.
In a statement, the Alzheimer's Association says it welcomes and is encouraged by the data.
A person in the earlier stages of disease has more time to enjoy with family, enjoy remembering who they are and who their family is, going on vacations, maybe going to one graduation, having a wedding, experiencing a birth.
Side effects include swelling, which was seen in about 13% of recipients, as well as bleeding in the brain.
There are very few options for people with Alzheimer's, but some health experts are concerned that the modest benefit of this treatment may not outweigh the risk.
So it's a very, very small, almost imperceptible rate of decline change. You really have to look closely and say, is the benefit worth the chance of side effects? And does the benefit actually improve the quality of life?
Last year, the FDA controversially approved another Alzheimer's drug called Aldahelm, despite questions about the risks and benefits, but many doctors and insurers are not prescribing it. The FDA is expected to make a decision on lecanemab in January. Jared Hill, CBS News, New York.
According to the Alzheimer's Association, there are more than 6 million Americans living with the disease. The Alzheimer's Association is calling on the Centers for Medicare and Medicaid Services to change their policy so that if the FDA does approve this new drug, Medicare beneficiaries will be able to access it. Meanwhile, a simple urine test could one day be widely used to detect early-stage Alzheimer's disease. The test recognizes biomarkers in urine, and researchers say it's more convenient and cost-effective screening when compared to brain scans and blood tests currently used to diagnose Alzheimer's disease. New research shows deaths related to drugs and alcohol are rising among Americans over 65. More than 5,000 people aged 65 and older died of a drug overdose in 2020 alone. Nearly 12,000 died from alcohol-induced causes, according to the CDC's National Center for Health Statistics. Those numbers are rising. Death rates from drug overdoses among people over 65 have more than tripled over the past 20 years, though health officials stress there are more resources and tools available to help than ever before. Stick with us. We've got more news straight ahead right here on Valley News Live. And Jim is back with a look at your Wednesday forecast.